Hi, my name is Dr. Dawn Ewing. This is Biological Dental Hygiene, Part 4. Dental toxins and the difference in biological dentistry. We know that dentistry is toxic to the patient and to the staff. Dentistry is toxic. Dentists have high divorce rates and suicide rates. Dental assistants have high miscarriage rates. If doctors kill patients with medicines, then dentists kill patients very slowly with toxic materials, and you'll see why. OSHA, what about mercury and formaldehyde? Disposal of mercury, we're finding out more about that. What about water filters? There's a lot of toxicity in a dental office. What kinds of dental work are we talking about? Root canals, extractions, crowns, and impactions. Look at this impaction. The tooth isn't even upside right, and it appears to have a cyst around it. That could be a problem. If we look at these crowns, number one, the crowns don't fit, and you also see that there's some resorption on the root, on the 6-year molar. Interestingly, this crown was just placed a few days before. They didn't bother to take an x-ray because the person is severely handicapped. They came in to see us because they were having a great deal of pain. When we look at the periapicals, you'll often start to pick up on things on root canals that you will only find if you take a periapical x-ray. So I'm going to encourage every biological office to make sure and monitor all root canals in someone's mouth. Look at this one. This is an anterior tooth. I oftentimes like to show x-rays of anterior teeth because it's not commonly taken any precautions on whatsoever. And so we only take those bite wing x-rays. Please follow up those root canal teeth with a periapical. We also look for things like periodontal problems. So when you see something that looks suspicious on a bite wing, go ahead and take a periapical of it. Sometimes we find things like broken tips of instruments. What can be done when a disturbance is found? If it's the organ, work to heal it. And that's not necessarily something that a dentist will do. That's where your networking comes in with a chiropractor or a naturopath or an MD or a DO. You want to use common sense and use homeopathic drainage remedies when needed. If it's in the mouth, you want to clean it up. You want to clean it out. If you forget to think about the teeth, you might get bitten. This is an old way before we realized that mercury could create little particulate and get on the skin of the patient. This was top notch at one point in time, where we covered the patient's eyes, we made sure that they were breathing air from a different environment, and that they had a rubber dam on with high-speed suction. But now we see flaws in this system where the skin is being exposed. We want to use or consider using things like a vapor ionizer to try to attract mercury out of the environment. So what's in a silver filling? Well, it's 35% silver, 50% mercury. So let's back up. Let's don't call it a silver filling because it's not 50% silver. We're going to call it a mercury amalgam. It's 13% tin and it's 2% copper, and it's got traces of zinc in it. Amalgam fillings contain 5 toxic metals: copper, tin, zinc, silver, and mercury. Certain organic compounds derived from some of these elements can be beneficial and nutritive. They should not be confused with these inorganic toxic compounds. Copper increases carcinogenic activity of nickel. It is emitted 50% faster in high copper amalgams. See, at one point in time, we thought if we added more copper that we would slow down the amount of mercury coming out. But we found out that that's not so. We also find copper in 90% of dental golds. One amalgam filling weighs about 1 gram. That 1 gram contains 1/2 gram of mercury. So the average adult has 10 fillings, meaning 5 grams of mercury are available. Let's put this in a way that everybody can understand. 1/2 gram of mercury in a 10-acre lake would warrant a fish advisory. In Minnesota in 1994, they banned running shoes with mercury lights because they contained 1/2 gram of mercury. The ADA's responsibility. In a case before the Superior Court of the State of California, the lawyers for the ADA stated, the ADA owes no legal duty of care to protect the public from alleged dangerous products used by dentists. California Proposition 65 applies to nickel too. The law states that if you expose someone to an item that can cause cancer or birth defects, you must inform that person. This does not prohibit the exposure, only informing the person of the exposure. So an example might be a mother that comes in with several children. She'll be offered a piece of paper that says this mercury filling has 50% mercury in it, and you are entitled to know that there is an option. It's a composite, but your insurance may not pay as well. So if the mom has kids tugging on her, she'll just ask quickly, what is this that I need? The insurance won't pay for a white filling. It'll only pay for the silver filling. Fine, where do I sign? It really is designed for the patient to read through the information. Proposition 65 gives the patient the right to know. It means that the doctors have a right to know too. You know that the American Dental Association for years educated dentists that mercury does not come off of amalgams. This information with Proposition 65 means that a dentist has the right to know what is being exposed from his materials that he's using. It covers mercury and nickel. The California Dental Board was dissolved over all of this, and in the summer of 2000, a judge in Maryland ruled that the Maryland State Board of Dental Examiners violated the law by prohibiting dentists from discussing the risks of amalgams. There was actually a gag order. The state regulatory actions in Maine, passed and signed by the governor in 2001, was for a poster and brochures for patients. And in New Hampshire, passed and signed by the government in 2002, no dentist may place a large amalgam filling weighing more than 1 gram. The amalgam filling under 1 gram must inform the consumer. What long-term effects are there and when? We place amalgam fillings in indigent mouths. We place amalgams in pregnant women. You realize that in California they did some research and found out that a lot of the prisoners had low serotonin levels, but they were given free dental work for indigent care and had several amalgams in their mouth. So they changed their laws so that if someone's going to have indigent care done, no amalgam can be placed. It has to be a composite. And of course now we have laws in place that mercury should not be used in a pregnant woman. Canada was actually instrumental in part of that. They passed that ruling before we did. Here's an example of amalgam fillings before they're being removed. Here's the process of them being removed. You see the rubber dam in place, which does not prevent any of the mercury vapor. We've got a high-speed suction on the other side. Here we see the composites in place afterwards. Years ago, dentists used to tell patients that the composites were not as durable and that the mercury fillings were just more durable because that's what they were being told. Mercury in the amalgams. Well, Candida has a purpose here. If you've got high levels of mercury in your body, you're going to expect higher levels of Candida to try to keep that mercury in check. You also may notice that there are increased cholesterol in this individual, and they have high numbers of LDL. The mercury can go to the brain, the kidneys, and the joints. It won't show up on blood tests. Remember that mercury does pass through the placental barrier, so you don't have to have mercury in your mouth to have mercury in your body. I'm a perfect example. I don't have any mercury in my mouth, but I had high levels of mercury in my body, and because it passed through the placental barrier, my son has some issues. Dental amalgams are a 24-hour-a-day toxicity. Here we see a mercury tattoo. So what is galvanism? Well, when two dissimilar metals are present in a fluid, we say that there's galvanic reaction, or the potential for one. When amalgams are next to gold crowns, it can increase the galvanic reaction. You see, traditionally in acupuncture, gold stimulates the body, and mercury and nickel can depress. Currents can be so high in the mouth that they actually affect the brain or even pacemakers. Do you have a battery in your mouth? The brain operates on 6 to 9 amps. Fillings and crowns, braces, and etc. can increase the current to over 100 microamps. It's so close to the brain, no wonder so many people function better when the excessive electrical current is removed. Here you see a device that is able to measure. It's one of a couple different devices that are out there that we use to look at the galvanic reaction off of each tooth. There's something called sequential removal, which helps us determine which quadrant to start in, the one with the highest negative charge. So what's in a composite? Some of them are plastic, some of them are resins, some of them are glass, some are plastic, and we even have metals, like the zirconia, where it's actually a metal. So what's in a crown? Most porcelain fused to metal crowns contain nickel as a base. Even when we used gold, gold crowns contain other metals to increase the strength. Nickel, in most of these crowns, can be carcinogenic. It has the ability to bind to oxygen, nitrogen, and sulfur-containing biochemicals. Nickel is immunosuppressive, inactivating natural killer cells. Plus, there are lots of women that are sensitive to nickel. It also can attack the visual areas of the brain. Orthodontics. Nickel is stainless steel crowns, and braces are often mixed with chromium and cobalt. Here are examples of different metals in crowns. The composition of the crowns, well, when you say it's gold, it's what percent gold. Porcelain fused to metal is oftentimes non-precious. New, non-metallic crowns like Empress or Targus Vectris or Dicor or Cerac still has some metal but not in available forms. Crowns versus onlays. Your tooth is a living organ and it detoxifies. It pushes its waste products out from the inside of the tooth through the tubules to the outside of the tooth, which is why you end up with a biofilm in the morning. When you crown a tooth, it smothers the tooth because it interferes with that natural process. If the dentist provides an onlay or an inlay, at least provides a window for the tooth to be able to detoxify. Here's an example of a crown versus an onlay. You see this window where the tooth is still able to push its toxins out. Here is an example of an inlay, where we see that most of the tooth structure is still intact. Yes, the dentist has to use more care, skill, and judgment to create a customized puzzle piece to fit inside this tooth. The use of high-speed drills may be controversial. because has the tendency to create a vortex and a suction which can create an emboli that goes to the brain. So we want to limit our use of high-speed drills in certain areas. A study at Loma Linda done with sugar passed through tubes which completely bypassed the mouth showed the reversal of the flow of fluid in the dental tubules. A healthy tooth detoxes from the inside towards the outside, and whenever there's an issue or a problem, it reverses the tubule flow. So when we take in sugar, it reverses that flow and we're able to take bacteria into the inside of the tooth. Don't you think it's interesting that we seem to see decay through these little microfractures in a tooth? Maybe that's part of the reason with all the introduction of the sugars we have here in our American diet. So what's in a denture? Well, the pink coloring could be cadmium. Some people are very sensitive to the methyl methacrylates. Some people react to vinyls. Some people even react to the teeth that are used. And many people react to the liners that are used in a denture. This is a traditional partial. You see the metal that crosses the midline? Nowadays we have options for this so that we're not risking putting something not only carcinogenic in a person's mouth. A lot of people don't like having metal in their mouth, but this metal can interfere with the electrical activity in the body. This would be a more natural or biological option. In this particular instance, this patient was a flautist and was very concerned that they need to have the ability to touch their tongue to the back of their front teeth on top, and so the dentist got very creative. Again, this is a person that was really disturbed about the possibility of not being able to put the tongue up to the palate for fear of not being able to taste foods. And so this dentist got creative in this instance as well. When you're looking at dental compatibility, you want to look at everything from the anesthetics to the filling materials, crown materials, cements, temporary materials, dentures and partial materials, orthodontic materials, as well as bleaching, toothpaste, anything that you use on the person. All dental restorations are foreign. There's nothing as good as what God gave you originally. Some of the healthier materials, no, they don't last a lifetime, but I would rather outlive my materials than have them outlive me.